Today we're going to go over a case scenario discussing the different responsibilities of the RN, the LPN, and the healthcare assistant. And if it's your first time here, welcome. I'm Ira. I'm a Canadian RN, nurse educator, and founder of nursingcollective.co. And let's get started on our case scenario. We have a 78-year-old male, Mr. Thompson. He was admitted to the medical surgical unit post-operatively after a right hip replacement. He is confused at times. He has history of mild dementia. He needs assistance with mobility. He has a urinary catheter and is on IV antibiotics for a UTI. He's also high risk for falls and has a stage 1 pressure injury on his sacrum. Just by reading this case scenario, can you figure out what's your responsibility if you're the RN and the LPN and the healthcare assistant? What would be the expectations from you? It's important to know the scope of practice if you're the RN or the LPN and the healthcare assistant, not only during an assessment, but most importantly, once you are practicing as a nurse. Because what we have to remember when we are practicing here in Canada, once you have your nursing license, that nursing license is regulated. That means it can be revoked if we do nursing actions outside of our practice. And that's why it's important to know that. Now let's go over what would be your responsibility if you're the RN. First, what I like asking my students is, what's the difference between head-to-toe assessment and the focus assessment? When can you do a head-to-toe and a focus assessment? And the answer is, a head-to-toe assessment is something you would do if your patient is stable. So that means the patient is not complaining of anything that needs intervention straight away. Also, another reason would be if a patient is new admission and you need to conduct a comprehensive head-to-toe assessment. Compared to a focus assessment, if a patient is complaining of shortness of breath or chest pain or abdominal pain 10 out of 10, that is something that needs intervention right away. So what you need to do is do a focus assessment and provide interventions and then evaluate your interventions. And if you have time, then that's when you can do a full head-to-toe assessment. But in this case scenario that we have, the patient is not complaining of anything that needs interventions now. So we have time to do an initial assessment, and that would be the responsibility of the RN. Also, the RN would be assessing for any risk of infection and also skin integrity, as this patient, if we go back to our case scenario, has stage 1 pressure injury on his sacrum. Also, if you're looking at this case scenario, the patient is also post-op after a right hip replacement. So that means the patient won't be moving as much. So that puts him more at risk for pressure ulcer. Another responsibility of the RN would be care coordination and delegation. So once you have done that care planning, it might involve collaboration with interdisciplinary teams. So you might need to do some referrals to maybe occupational therapists or physiotherapists or dietitian in this case as well. And that's something that the RN will do. Another thing would be delegation. And how can you delegate when you don't know the scope of practice of the LPN and healthcare assistant, or at least familiar with it? And that's why it's important for you to know that. Third would be IV antibiotics management. For the RN, if it's IV antibiotics, you're the one who needs to do it, as the LPN cannot do IV antibiotics. You're the one who's going to be administrating the IV antibiotics. You need to initiate, you need to monitor, and you also have to evaluate the response of the IV antibiotics. Is it effective, right? So you need to do all that. Last thing would be pressure injury management. As what we discussed earlier, this patient has stage 1. So you need to do a wound care consultation, document what you see, what you've assessed, and then do some implementation. And maybe you also need to do a referral to a wound care nurse if there is any. Maybe not for your Inspire Global assessment, but once you are working in the hospital, a lot of the hospitals and long-term cares, assisted living, we have wound care nurses who would actually look at the patient's wound and then create a care plan and protocol for the wound that the healthcare team will just follow. So in this case scenario, the LPN would be doing the neurovascular check for the hip, that the patient had surgery on, do full vital signs as well, and do cognitive status. So you'll still do your assessment on this patient, but it's just more focused since the RN already did the initial head-to-toe assessment. Next would be catheter care. So you can monitor the output of the patient, making sure the catheter is draining correctly, proper hygiene, right? You can do some teaching around that as well if you want, and also abnormalities. If there's any sediment, if there's any blood, things like that. So you would report the abnormalities to the RN as well and maintain catheter hygiene. Next would be medication administration. So we talked about IV antibiotics, so that's the RN doing that. For the primary IV, right, maybe it's something like this. And just remember, always put your label, okay? And then the secondary IV, like this one, okay? So another label as well, and knowing how to do a primary and a secondary IV, and doing your medication administration safely. With the LPN, it's more routine medications such as analgesics, anticoagulants, laxatives, and monitoring the patient for any adverse effects, adverse reaction, and you can do some teaching too about medication. During your SLA, 100% you will be doing medication administration, so make sure that you are familiar how to safely administer medication. So the LPN will monitor the pressure area for any changes, apply any skin barriers, do wound care if needed, and ensuring as well that the patient is being repositioned every 2 hours. As the LPN, repositioning is something that can also be delegated to the healthcare assistant. And if there's any concerns and it needs to be escalated, then you will report that to the RN, and the RN can do further assessment on it as well. For the healthcare assistant, the HCA will support Mr. Thompson's ADLs, hygiene, grooming, toileting, nutrition, mobility as well here that you can see, fall prevention because the patient is falls risk. So transferring, repositioning, and ambulation. So if you're a healthcare assistant and you're going to be doing your SLA, that's something that I would focus on as well, is knowing how to safely do that. All this mobility, like the transferring, repositioning, and ambulation of the patient. How would you feed the patient? How would you toilet? Next here would be observing and reporting. So the healthcare assistant reports if Mr. Thompson is refusing or if there's any signs of deterioration, changes in behavior, if there's increased confusion, right, or any changes in the patient's behavior or mobility. The healthcare assistants are the eyes and ears of the nurses. Lastly, this is something that healthcare assistants will be tested on is patient safety. So ensuring a safe environment for the patient. So the call bell, the bed is at the lowest height, there's free of any clutter or any harm, not just for the patient, but for you as well, and also proper usage of mobility aids. So fall prevention in this scenario is very important, and that would be a key responsibility as well, not just for the nurses, but for the healthcare assistants. And to finish off, key takeaways are knowing your role, knowing your scope of practice again, because that means patient safety and also your safety as well. The RN is the one leading and delegating, and the LPN is the one that's supporting and monitoring, and of course doing assessments as well. And the healthcare assistants provides personal care. And I have some reflection questions here that when you're doing your SLA might come in handy. So ask yourself, am I working within my scope? Next, when should I escalate or delegate? How does my role impact patient outcomes? And that's it for today's video. I hope you guys found that helpful. I wish you the best of luck. And I know it can be overwhelming at times. Don't forget to take breaks and take it one day at a time. Thank you guys, and I'll see you in the next video.
If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video.